There's quite a lot of poor information in regards to headaches and migraines out there, and there are actually quite a lot of myths in regards to headaches and migraines. So today we're busting down the myths so that you've got some more accurate information in regards to headaches and migraines. So hi, I'm Dr. Beth, osteopath here at Melbourne Headache Solutions. If you've got any questions or queries in regards to your headaches or migraines, or any information that you're not sure whether it's actually true or whether it might be a myth or anything that you're just curious about, drop a comment below and I'll get back to you as soon as possible. So, as I said, there's a lot of misinformation in regards to headaches and migraines, and there's a lot of things that we hear commonly in regards to headaches and migraines in terms of helping them or decreasing them, but it doesn't necessarily mean that they're true just because we hear them repetitively. So, as I said, that's what we're going through today, some of the most common things that we hear to try to help give you the most factual information possible and help to decrease your headaches and migraines as well. So, one of the most common things that we do here is I had the onset of a headache, I had the onset of a migraine, but I drank lots of water, but it didn't actually help. So, when it comes time for water and when it comes time for dehydration headaches and migraines, then it's actually a lot harder to give yourself a dehydration headache or a dehydration migraine than you might think. They're far less common than people seem to think that they are. So you're more likely to get a dehydration headache or a headache or migraine that's set off by a lack of water on days when it's really hot or when you're in a stuffy environment, when you've been playing sports, when you're in an environment where you've got artificial heating, so in winter when you've got the heating on, and particularly when it's cranked up quite high, when you're in, as I said, like a stuffy environment, so when you're in, say, like a work meeting, so not where we are at the moment because we're all on Zoom, or those sorts of things, but when we have been in environments where we're in a room with lots of people and it's quite stuffy and we don't have a lot of air in there, and so these sorts of things. And so when we're in these sorts of environments, or as I said, like, we've been playing sport and we're sweating a lot, and that then we do tend to start to decrease in terms of our hydration levels, and so we do need to make sure that we're drinking quite a lot of water to make sure that our hydration levels are staying elevated. The other thing in terms of hydration is that we do need to make sure that we're making sure that our electrolytes are also maintained. So for instance, on a hot day when we sweat, then not only do we sweat out water, we also sweat out our electrolytes, which are salts. And so if we're getting a headache due to dehydration, then if we drink something like Hydrolyte, which also rebalances our electrolytes, then you're much more likely to get over the headache and also feel far more refreshed sooner rather than later. But these headaches are far more likely to be acute headaches and few and far between. They're not likely to be your chronic headaches or your chronic migraines that you're experiencing. So if you're experiencing your chronic headaches and migraines and you're drinking water to try to relieve them or to try to stop them or prevent them, then this is not likely to be the case. It's not likely to help them, okay? It is definitely good to maintain your hydration levels because it's definitely good for your entire body and to make sure that your sensitization levels is not increasing, but it's not one of the things that is actually going to stop a migraine from progressing, okay? Or stop a headache from progressing, because most of the time it is not due to dehydration, okay? As I said, it's more due to those other situations that I mentioned. However, as I was talking about, electrolyte levels is very important in chronic headache and migraine sufferers. Some people, when they're having the onset of a migraine, then they crave salt, okay? They crave salty foods, or if they eat salty foods, then they actually notice that their migraine or their headache improves. So with some people, then, as I said, their electrolyte balance is off. So two of the most important electrolytes are actually sodium and potassium. And it's really important to have your electrolytes in balance, okay? So you can be too high in one, you can be too low in the other, which actually means that you've got an increased sensitivity to setting off a migraine or to setting off a headache. So if you have your electrolytes in balance, then it actually means that it's harder to set off a migraine. So electrolytes are very important in regards to chronic headaches and migraines. So this is something to bear in mind. So on that front, in terms of talking about foods and down this pathway, then sometimes people go, okay, well, when I've got the onset of a headache, then maybe if I just eat something, then it will make my headache feel better. Because maybe I need the sugar. Now, for some people, this can be true, but for others, then they've just eaten something and it doesn't make any difference. For the ones where it does make them feel better, then it's more likely that their blood sugar is spiking. It's going up and down throughout the day, and due to a drop in their blood sugar, then they're initiating a headache or a migraine. And so for these people, then we want to be making sure that their blood sugar levels are staying more even, more consistent throughout the day, so that their blood sugar is not acting as a trigger for them. So you want to be eating foods that are more consistent, giving you that more stable blood sugar levels throughout the day. So more things like healthy fats and proteins, and lower in carbohydrates, because carbohydrates are our short-acting energy bursts. Okay, whereas if we eat our carbohydrates consistently and quite high throughout the day, then they give us those big spikes and big peaks throughout the day. So they're our sugary foods, and things like our pastas and our rices and those sorts of things, and breads. So our good fats, our good proteins, and those sorts of things are more the foods that you want to be eating to avoid those spikes in the blood sugar. Okay. Then we come across things like caffeine. So when it comes time for caffeine, then headache and migraine sufferers have a really interesting relationship with caffeine. For some people, they report that it gives them a headache or a migraine. It's a trigger for them. Whereas other people say, well, actually, if I take it early enough, if I drink it early enough, then it can actually really help and stop a headache or a migraine. The reason why is because caffeine is actually a type of drug. Okay, it's a drug that we take in coffee. It's a drug that we take in soft drinks, and it acts. It's a stimulant, and so it can actually, if it's taken with medication, and there are certain types of medication that do have caffeine in it, it can actually help to make medication be absorbed quicker. But it can actually help to stop a headache or a migraine in its track. Depending on the person, and it also depends on the caffeine level as well. So as I said, it's person dependent, and whether it's a trigger or not, and also depending on the level of caffeine. The thing with caffeine though is that it can also lead to rebound headaches if taken too often, okay, and if consumed too often. And this is why coffee drinkers in particular, if they stop having their coffee, or like they have a coffee every morning at say 8 o'clock, and then they don't have their coffee until 10 o'clock the next morning, they start to get a little bit of a headache. Their body's gone into a bit of withdrawal, and then they have their coffee, and then the headache goes away. So the same sort of phenomenon can happen with headache and migraine sufferers. They go into this rebound headache, and their headaches can accumulate and accidentally get a few more headaches if we have things like coffee too often, or medications too often. So as required medications too often. So we just want to be mindful of caffeine and not use it too often to try to treat headaches and migraines like that. However, that is the relationship that can happen with headache and migraine sufferers. So if you do notice that it does help your headaches and migraines, then that's why it can be relieving to try to stop it. But just be mindful that it can add to your pain if it's used too frequently, which of course we don't want. Down the medication pathway route, then another one of the myths that we hear all the time is that people say, I've tried everything. I've tried absolutely everything to get rid of my headaches and migraines, but nothing has worked. A lot of the time when people have been saying this, it's because they've actually tried a lot of different pain relieving medications. So they really do feel like they have tried everything. But a lot of the medications that they've tried are as required medications. So they're medications that you take when you have an attack. Okay, so when you have a headache, when you have a migraine. And so they do nothing to prevent the next headache or migraine from coming on. Okay, so with this type of treatment, then it means that you're never working to stop the next attack from coming. What we want to do, and where treatment should be aimed at, is to try to prevent the next attack from coming on, so that we aim for long-term results. And we do this by treating and targeting our treatment at the cause of headaches and migraines. And there are so many things that can contribute to the cause of headaches and migraines, including sleep, diet, stress, hormones, the neck, grinding, your jaw, many different things that can contribute. And so when we target the things that can be causing your headaches and migraines, that's when we aim for those long-term results. And that's also when we aim to prevent the next attack from coming, and the next attack from coming, and the next attack from coming. So that's how we aim, as I said, for those long-term results, instead of just aiming for that symptomatic approach, which is just targeting, treating that current headache or migraine. Okay, so the last thing is that I hear people say, I have a normal amount of headaches. Okay, when I ask them how many do they get, well, I get a normal amount of headaches. Well, how many is a normal amount of headaches? And they say, 1, 2, 3 a week. I go, you do realize that that's quite a lot of headaches? And then they go, no, not really, like that's just a normal amount. And it's because headaches and migraines have become quite a common thing in society. There's millions of people. There's 5 million people that suffer with migraines and up to 7 million people that suffer with tension type headaches in Australia alone. That means at least you or someone else you know are suffering with headaches or migraines. And I can pretty much guarantee you that you know at least more than one person that's suffering with headaches or migraines. So they've become a really common thing in our society. And so just because they're common doesn't mean that they are supposed to be there. When we've got pain, it means that there's an indication that there's something wrong. It's a warning sign telling us that we need to do something about it and that we need to alter our behavior in some way. So if you've got something like lower back pain, and I ask you, well, how often do you get lower back pain? And you said, about 3-4 times a week, then will we take this as a good sign? Will we take this as a normal sign? No, we would say that we need to do something about this. And it's the same thing when it comes time for headaches. Okay, it's a warning sign. It's telling us that there's something wrong and that we need to do something about it. We need to change our behavior and we need to find why we have this pain. Okay, so the answer when it comes time for what's the normal amount of headaches is next to none. Okay, it's not 1, 2, 3, 4 times a week. It's next to none. We should be aiming for 0. That's what we're aiming for. Okay, now sometimes things pop up, like as I said, dehydration, or you do have low blood sugar, or you have had a bit of a stressy day, and so we do tense up a bit. But we should be aiming for a very low number in terms of headaches and migraines because, as I said, pain is a warning sign that there's something going wrong, and so we should be listening to these warning signs and doing something about it. So as I said, the causes of headaches and migraines combined tend to be things like diet, stress, hormones, musculoskeletal complaints like your neck, particularly the top 3 joints of the neck, jaw, clenching, sleep, and all these things combined. And often it's a combinatory approach that needs to be done to look at multiple areas in order to get the best results possible. So we have a massive passion here at Melbourne Headache Solutions in order to help people with chronic headaches and migraines, because we know that there is such useless information out there most of the time, and there's a lot of confusion in regards to headaches and migraines, and often people are left suffering for years and years and years needlessly with their headaches and migraines. So if you are confused about your headaches and migraines, if you're sick of suffering with your headaches and migraines, if you've got any questions or queries about them, drop a comment below. Let me get back to you. I'm happy to answer any questions that you might have. If you've got any myths or anything in regards to your headaches and migraines, as I said, drop a comment below. And if you're interested in seeing one of our practitioners so that we can help you on your journey with your headaches and migraines, please call the number above. I've got it listed in the comment section or the description above, and we would love to see you so that we can help you on your journey as well. So I hope you found this helpful. And as I said, any questions, drop them below and I'll get back to you. Thanks for listening, and I'll catch you next time.